Hello there, my name is Elizabeth Tyner. I'm Director of Pharmacy at Logansport Memorial Hospital. So I oversee the day-to-day activities and the inpatient pharmacy. So we take care of the inpatients here at Logansport Memorial and outpatient surgeries and that sort of thing. I've been here for 27 years, so we're going to talk today about managing your medications at home. So when we think about medications, a lot of times we don't necessarily think of them as powerful chemicals, but all medications that we put into our body, both prescription and non-prescription, are technically chemicals. So used properly, they're a good thing. They can treat conditions and make us feel better, help us get healthier. If used improperly, they can make conditions worse or possibly cause additional or unwanted problems. So the more medications you are taking, the more risk of problems. So the bottom line is every person should be responsible and know their own medications. You don't want your spouse or a daughter or son to be in charge of your medications necessarily. They can help you make sure you take them correctly, but every person should have some idea of why they're taking each medication. So benefits of medications. They prevent illness. So every year we get our flu shots, immunizations for children. That helps prevent illness and keep us healthy. To treat conditions like high blood pressure, diabetes, high cholesterol, those chronic conditions that we don't necessarily feel symptoms for every day, but these medications help control and keep us healthy from those conditions. Fight infections. Those are things that we feel badly. So medications make us feel better with those and help get the bacteria and viruses out of us. Relieve pain and symptoms. So that's after an injury or after a surgery, relieving that pain and helping us heal and helping us get back to our daily activities. So all those are good benefits of medications. Potential risk of medications. So some medications, if used long-term, can cause some sort of drug dependence. So a lot of these can be for pain or for mood, and our bodies just become dependent on them. So that is something to be careful about. Unwanted side effects. And again, like we talked about in the beginning, every single thing we put in our body can potentially have a side effect. So whether seems like a benign medication used to treat, high blood pressure can have a side effect. Herbal medications can have side effects. So it doesn't really matter how natural they are, they can still have side effects. Unexpected interactions either with other medications or with foods. So again, everything we're putting in our body, even food, can cause problems or potential benefits. So if we're using medications that interact with certain types of foods, we can have reactions to that or unwanted effects. And as we get older, our kidneys and our liver, they start to slow down a little bit, and that can affect how the medications are broken down in the body. So sometimes then our doses may need to be adjusted, or the intervals between the medication doses that we take need to be adjusted. So medication usage. And on the slide there, you'll see some pictures. But medication compliance is low due to a variety of factors. And when we say compliance, that means taking medication as it is prescribed every day, every dose. So the problem arises when your provider thinks that you're taking it as he or she prescribed it to you. So if you're taking, for instance, a blood pressure medicine that you're supposed to be taking twice a day, and your doctor thinks you're taking it twice a day, and you go in, your blood pressure is still high. So they add a different medication to that or increase the dose. They're increasing that or changing that regimen based on the knowledge that you were taking it as prescribed. So that can cause problems because then if you do then take it as prescribed plus add the new medication, then your blood pressure can go low and get unwanted side effects. So that's why the compliance becomes a problem and communicating that. When patients go into their provider's office, they don't want to say, well, I don't really take it like I'm supposed to, or I forget it, 3 times a week. You don't want to admit that to your provider. So being honest with them in the end will help tailor your care. So as this picture shows, 100% are prescribed when about 12% of those prescriptions never get filled. So if a provider gives you a prescription, about 12% of those never even get filled the first time. And out of the ones that get filled, only 76% of those then actually get taken. And then when it comes time for a refill, you're down to less than 50% of those original prescribed medications actually get refilled for the second time. And again, that's a number of reasons, especially for chronic conditions like high blood pressure or, congestive heart failure or something like that. You don't really feel any differently. So a lot of times people perceive that the medication isn't working when in fact it is, you just don't feel any differently. Which kind of goes into the next slide, I guess. So patient perception leads to noncompliance. So the biggest reason for noncompliance is patients forget to take them. So a new medication, we need to work it into our routine. So if it's a once a day, you want to time it. If it can be taken with food, the best thing to do is time it with a meal so that you can remember to take it. If it needs to be on an empty stomach, then maybe in the morning when you brush your teeth, maybe a half hour, an hour before you eat something is a good time to take it. Bedtime is another time to take daily medicines because we go to bed every night. Just trying to get into a routine and matching that with something. In the age of technology and smartphones, not everybody has a smartphone or knows how to use it. But setting reminders on there when you get a new prescription just to kind of get into that habit of taking it about the same time every day is a good idea. So this, as this slide shows, once you run out of the medication, like we said, people don't refill it because they don't perceive that it's doing anything. Too costly, and that's a big thing, especially with brand name drugs. They are pretty expensive. And side effects is another reason. So lots to think about there. So common mistakes with taking medications, taking the wrong dosage is probably the biggest mistake. So if you take too much, obviously you can get unwanted side effects or the drug's working too well, that can cause problems. Taking too little can keep the medication from doing its job, so we just perceive that it's not working. So that's why it's important to take what is being prescribed. And then your provider can make adjustments based on your response to that, knowing that you were taking the dose that was prescribed. So mixing food and medications. Your pharmacist should tell you or stick labels on your bottle to let you know if it needs to be taken with food, if it needs to be taken with an empty stomach, or if you need to avoid certain medications or certain other types of antacids or foods with that. There is a whole group of antibiotics that you don't want to take with antacids or dairy products within a couple hours of consuming those other things. So those are all things that will affect how well your medication works in the body. And then some do need to be taken on an empty stomach. So again, that should be noted by the pharmacist or on the bottle. Incorrect scheduling is another thing. So medication should be taken at certain times during the day. And if a dose is missed, you don't want to double up on that next dose. So for instance, if a medication is supposed to be taken first thing in the morning on an empty stomach and you forget and you eat breakfast. If it's like before lunchtime and your empty stomach again, you can take it. I wouldn't wait until like dinner time and remember, or bedtime and take it, and then take it again the following morning. So if you remember within a certain, a decent amount of time, you can go ahead and take it. But if it's so close to the next dose or getting pretty close to that next dose, then I would not double up on it. Taking the wrong medication by mistake. So this actually happens more times than you think. And we do see patients in the ER come in, taking their spouse's meds, or, there was, a child's meds sitting there with theirs on the counter, and they've accidentally taken the wrong medication. So always check your labels. If you do a med box, make sure that whoever's filling it for you, if it's not yourself, that they're making sure that they're reading the labels and putting them in correctly, and then that you're taking them as they are in the med box. Mixing medications with alcohol. So alcohol can obviously affect how medications are working in your body, and they can also kind of exacerbate or make side effects worse. So especially medications that can make you sleepy or drowsy or dizzy, adding alcohol to that can really intensify that side effect. So especially drugs that say caution, you shouldn't drive on this medication, is a big sign you don't want to drink any alcohol with those. Understanding each medication. And so this again is where, like we talked about in the very beginning, everybody needs to take a personal responsibility to know what each medicine is for. Now, one thing I truly believe is when we talk to patients about medications, it helps in compliance if they understand why they're taking the medication. So for instance, if a patient's got 3 medications and the doctor tells them they're all for blood pressure, why do I need 3 medicines for blood pressure? Why can't one just work? Well, if we can help them understand how they're working together, to normalize that blood pressure and make them healthier, it helps in compliance because it makes more sense to the patient or the individual. So talk to your provider, talk to your pharmacist about when you get prescriptions filled. If you have questions, if you don't understand why you're taking two for potentially the same thing, or why we're adding something new, and ask until you understand. I mean, that's why they're there, is to help you understand those questions. So be sure you know the medication name, what it is used for, how much to take, when to take it, and how long you have to take it. Because a lot of the prescriptions, when they're sent over the computer, or e-scribe as they call it, one of the fields on there is, it will ask the provider to put in quantity. Well, one way to put in quantity is just to put in 30 days. So a lot of prescriptions nowadays will say, even if it's for blood pressure medicine, it'll say take 1 tablet daily for 30 days. So if you don't know that medication is going to continue, you're going to think, well, I'm only taking this for 30 days and it's going to stop. That's definitely a problem with the system, and that's a problem with the way the computers are communicating with each other. So know what they're for and how long you're really supposed to take it, and if it needs to be refilled beyond that 30 days. So also know, like we talked about, any foods or drinks to avoid, any activities to avoid, and any possible side effects. If you're taking a new medicine and you just can't tolerate it, you don't want to just necessarily stop it. You always want to talk to your provider about that and see if we can switch it to something else. So always make sure your provider and your pharmacist know what medications you're taking, including non-prescription and herbal medications. And that goes back to those drug interactions. So even if you're getting all your medications filled at the same pharmacy, even if you're using mail order or taking herbal medicines, they can profile all those things on that computer for you. So say you're going to any pharmacy in town, but you also have to use a mail order. Make sure that pharmacist at your local pharmacy knows what you're getting from your mail order. They can profile that so it will screen for interactions, as well as if you're taking any herbals or any routine over-the-counter medicines. And keep updated in the systems regarding allergic reactions and adverse reactions to medications. If you had a reaction to the latest antibiotic you were on, make sure the pharmacist knows that so they can include that in your profile, and then also make sure your provider's office knows that so they don't accidentally prescribe that or a similar medication for you again. And then share your lifestyle with both your provider and your pharmacist too, if you use tobacco or if you use alcohol on a routine basis, because that will affect certain medications that we can prescribe. So sometimes you don't necessarily want to be honest about these things, but honesty will help provide their care or tailor the care to how our lifestyle is. So prescription labels, before you leave the pharmacy, especially if it's a new medication, make sure you look at the label and understand what it's telling you to do. Sometimes they're not real clear. As pharmacy staff members, they do this all day long. So what is clear to them may not be clear to you. So if it says 1 time a day, but you're not sure if that means morning, evening, or middle of the day, go ahead and ask. Because sometimes it's not real clear. If your provider told you to take it in the morning and your label says take it at bedtime, clarify that. Because sometimes wires get crossed. Make sure it has your name on it when you pick it up. Sometimes mistakes happen and other people's medications get mixed in with yours. Make sure the medication name and the directions, quantity, and refills match what you're expecting. If there's warning labels, those extra auxiliary stickers on there, if they raise any questions or cause anything to think about, ask those questions as well. If you have trouble opening the lid and there's no young children in your house, make sure that you ask for an easy open bottle as well. So some do's, if you experience any adverse reactions, contact your provider. Like I said, they can change therapies a lot of times and get the same end result, but something that you're going to be able to tolerate better. Make sure you store your medications appropriately. Probably the worst place to store your medications is actually in the bathroom in the medicine cabinet, because that's a warm, moist environment when we take showers, and that's not the best storage conditions for medications. So honestly, a kitchen cabinet up high, away from small children, is probably the best place to store your medications. And again, that kind of brings the next one, keep them away from children. Dispose of medications properly. So there are places around town. I know in community pharmacy there's a disposal bin. If there's any medications that have been stopped, that you're not using anymore. Disposing of them securely like that keeps them from, someone getting into them in your trash or whatever, or causing environmental concerns in the landfills. Make sure you keep all appointments with your providers and make sure that you're honest with your provider. If you're missing doses, or if you just aren't able to tolerate it because it's giving you an upset stomach, or if you feel like you get a headache when you take it, make sure the provider knows that so they can make those adjustments, and they're not making adjustments on your regimen thinking that you're taking it like you're prescribed. And monitor disease control. So, if you're taking something for high blood pressure, monitor your blood pressure, even if it's when you go to the pharmacy and use the machine there, or if you have a machine at home. If you're taking something for diabetes, make sure you're monitoring your blood sugar like you're supposed to. It's better to do multiple readings like that and take those readings with you to your provider rather than say blood pressure. They're taking one blood pressure when you go into the office. They have one number to look at. So generally we're a little more nervous too when we go in to see our provider. So our blood pressure may run a little higher at that time. So having, 2 weeks of random readings will help the provider see what you're actually running as on a more general basis. So things that we don't want to do is we don't want to discontinue our medications without talking to our provider. Those chronic meds are hard because we don't feel any differently. Taking blood pressure medicines prevent us from having a stroke or a heart attack. So, that's a good thing. Blood sugar medicines keep our blood sugar nice and steady. So overall, that helps our blood vessels, our eyes, our kidneys, all other organs, keeps us overall healthier. So, but we don't feel any differently. So from a day-to-day situation, we can't tell that we're treating and we're staying healthier. So it's hard, especially if they're costly, to take them like we're supposed to. But knowing in the long run we're healthier and understanding why we're taking them makes a difference. So don't use someone else's medications. They were prescribed for that person based on what their condition was and what other medicines or what other things they're taking. So, we don't know what interactions that person's medicine has with yours. So taking someone else's medicines is not a good idea. And don't keep medications after they're expired. So you don't want to use like half of your antibiotic now and keep the other half for the next time you're sick. Not taking a full course of antibiotics will or can lead to resistant organisms. So, and then it may or may not work the next time around, or it may be expired. So you always want, even when you're feeling better with antibiotics, you want to make sure you're completing the entire course of antibiotics. And don't take any medications unless you understand all of the directions and precautions. So again, that goes back to communication and asking questions. If you don't understand something, or if you think maybe it's giving you a side effect, call and ask. Call and ask your provider, call and ask your pharmacist. Organize your own system. So everybody compliance aids works differently for everyone, I guess. Some people do better with just keeping them in the bottles. Keeping them in the cabinet, keeping them in order, or keeping them in certain baskets morning and evening, depending on how many you have. Some people use charts or tables and maybe have them color coded and put dots on I've seen it all. Put dots on the lids, maybe blue at night and red in the morning, so that they can kind of keep track. I'm sorry. The medication boxes is another thing. And again, that's helpful if you have several medications and a family member can help you to get those in there. So it's something that, and then compliance helps too, because if your morning one still has meds there, you didn't take them. So there's memory issues. And then, like I said, the smartphone systems or alarms, those are good reminders too. Just to set those alarms. Hey, I need to take medicine at noon. Noon's a hard time because if you're not somebody that stays at home all the time, you're maybe out and about and not have your medications with you. So setting a noon alarm is helpful if you're taking medications in the middle of the day.